guys, welcome back again to my YouTube channel. My name is Ria. If you're seeing my face for the very first time, you're highly welcome, okay? And if you're a returning subscriber, thank you so much, guys. What's up with you? How are you guys doing? Thank you so much for coming back again. Ever since I put out this video talking about how much I earn, and now that I'm working as a healthcare assistant, I've gotten a good amount of questions. People asking, how did I get the job? How to get a job as a healthcare assistant with no experience? How can I get the job? What can I do? What do I need to know about the role? And this video is going to answer all of your questions, or most of your questions, okay? Because you might have further questions after you're done listening to me, okay? So just leave it down in the comment section. So if this is the kind of video that you're interested in, then please do keep on watching. One is understanding the role of a healthcare assistant. Okay, so before you begin your journey to say, oh, I want to become a healthcare assistant, you need to kind of understand what the job entails. Okay, it's very important that you know what you're actually going to be putting yourself into, and if this is something that you're able to do, because at the end of the day, not everyone actually can do this role. Okay, basically the role of the healthcare assistant is to support the nursing staff to provide care for patients in different settings. You could be working in a nursing home, you could be working in a hospital, you could be a healthcare assistant that delivers care to people in their home, so they call that home care. Okay, you could also be a healthcare assistant that also delivers care to people in community, so like community care or community outreach. Okay, so there are different settings. That's one thing that you need to know. And some people may like to work in the nursing home, some other people may like to work in hospital, some other people may like to work in people's homes, just go to their homes and go back to your own home. You don't have to stay there for as long as. Each of these settings has their own disadvantage and their own advantages, so it just boils down to what works for you. So now the key responsibilities of a healthcare assistant. Number one is personal care, so assisting patients with personal care, just like you would assist yourself. So what that's like: having a bath, dressing them up, and also feeding them. The next responsibility will be mobility assistance, helping patients move around safely. So people that are using a relator, or people that are using the wheelchairs, or people that have to use like the body hoist, the standing hoist, just having to help them move from one place to another. So mobility assistance is also another key responsibility of a healthcare assistant. Another key responsibility, I think this one is actually not spoken about a lot, but it's very, very important, is observation. So you're like the first point of contact for these residents. So your job is to actually observe them. Okay, whatever changes that you have noticed, maybe they are not in a good mood today, or they're in a good mood today, they're not eating well, they're losing weight, all of these observations, regardless of how small and unimportant you think it might be, your job is to report it to your next line manager, which would be like the nurse. And if it's something so serious, then the nurse would kind of escalate it to the clinical nurse manager, and then it continues, goes like that, and like that. Okay, so in summary, your job as a healthcare assistant, you're playing a vital role in enhancing the quality of life for patients or residents, however you call it. You're providing both physical and emotional support to these people, and this is such a demanding role that not everybody can do. So once you've known the responsibilities and the roles of a healthcare assistant, and you're like, what, this is where I thrive in, this is what I would do effortlessly, then good, let's now go to the next thing that you need to be able to become a healthcare assistant with little or no experience. The next one will be your educational requirements and training. Okay, I recommend 2 courses for you to actually get there. The first one would be the QQI Level 5 Healthcare Support course. Everyone at this point kind of knows about this, but if you do not know, this course is like the gold mine that you need to be able to put yourself in put your leg in the door, even without any experience. If you are able to get your QQI Level 5 Healthcare Support course, whether or not there are 8 modules in it, so if you can get 8 modules and you are fully certified, great. But if you can at least get 2, there are 2 of them that are very important. The first one is care of the elderly persons, and then the other one is care skills, I think so. If you're able to get these 2 courses at least, you're going to put yourself further than people that don't even have this QQI Level 5 Healthcare Support course. Okay, it's a widely recognized qualification here in Ireland, and it covers essential skills and knowledge actually needed to perform this role to the best possible standard. Okay, second certification will be the first aid certification. So basic first aid training can sometimes be required. In most cases, you just leave it. It's mostly for like the nurses, especially if you're working in like, you know, in a hospital or a nursing home or even like home care. Home care, the first aid may, as a healthcare assistant, you may have to do it first before even maybe calling like a nurse or maybe the ambulance or whatnot, because you're kind of like the only one in that space, and you are not going to have a lot of help that's always with you all the time, as opposed to if you're working in a nursing home or a hospital where like you can easily get like 1 or 2 nurses or even like a doctor on ground as well. So first aid certification is not really important. It's not something that they will say, oh, if you don't have it then you can't become a healthcare assistant. But you see that QQI level 5-1, it's becoming very, very important here in Ireland, because even if you get your job as healthcare assistant and you get your work permit to work in 2 years, if you're going to renew for like the remaining 3 years, you need, this is not even based off on any nursing home guidelines or any HSC guideline, this is coming from the government. You need to submit your QQI level 5 healthcare support course for you to be able to get the remaining 3 years of your work permit, because without it then there's no permit for you, to be honest. So it's very important here in Ireland. The next tip that you could do, you know, to be able to get you on that path would be to actually gain practical experience. Experience is so important, honestly, in anything that you do, as little as maybe even volunteering. It doesn't have to be like you need to be paid for the job. You can go to like your nearest hospital close to your home and ask to be a volunteer, or even like a nursing home, or even just in your house. You know, we kind of have like people that we could potentially be taking care of, maybe your grandparents, you know, or someone who just really needs care. It doesn't have to be like an elderly person, as long as you can show to them that you have this experience and you know what you're going to be talking about. Because sometimes it's one thing to say, oh, I have this experience, put it on your CV. When you go to the interview, there's some terms or there's some questions that only someone that has done the job can be able to answer. Those kind of questions, they become very much technical in their interview questions, to be honest. It's not as easy as, so you kind of have to gain, you know, this practical experience. It would help you, not just for you to just put yourself in the healthcare role or put your leg up just for you to get the job, but also for you to kind of have an understanding, look at it as a trial run. If you gain this practical experience even as a volunteer, then you can decide for yourself, is this something that you really want to do? Because like I said, this job is not for everybody. Not everybody can do it. A lot of people cannot do it, okay, and some people just kind of do it just because, okay. So you have to just gain that practical experience for you to know, like, you know, is this something that I can do? Is this something that, you know, I want to do? So volunteering is such a big way to actually get your foot into the door. Okay. The next tip would actually be to develop essential skills. Certain soft skills are actually crucial for success as a healthcare assistant. Key skills which include compassion, communication, patience, and attention to detail. So under compassion, do you have like a genuine desire to help other people? Under communication, do you have clear and effective communication? Like, can you communicate properly, both verbally and non-verbally? Because in healthcare roles, okay, even as a healthcare assistant, sometimes not everybody can speak to you in plain English, okay, like in simple English that you can understand. Sometimes they don't have to talk, just like their body language. Can you understand non-verbal communication? Okay, that's also very important as well. The third one, which is patience. Do you have the ability to remain calm in very high stress situations? Okay, can you take your time? Are you the one that quickly just wants to get task done and out of the way? Are you the one that would say, you know what, I have like 5-10 minutes to spare, and just kind of listen to whatever it is that you have to say, like without having to worry about other things that you have to do? You know, can you remain calm? So let's say if a patient or a resident had fallen down on the floor, how is your stress level? Like, you get really stressed, like would you even be now the next person that are going to be taken to the hospital and not even the resident that's on the floor? Okay, you need to be able to develop patience. You need to be able to develop a very calm demeanor when it comes to very high stress situation, because you encounter a good number of it if you're going to be working as a healthcare assistant. The last one is attention to detail. How observant are you? Pay attention to the needs of the patient or the resident, and also not just pay attention but communicate that to your next line manager. So after you've done all of these things that I've just said, the next one would be job search, okay, which is the one that everyone is kind of waiting for. So job search and application process. I'm just gonna read from here. So when you're ready to start applying for jobs, you know, there are different steps that you kind of have to take to be able to increase your chances of being successful, okay. So for online job portals, so there are websites like irishjobs.ie, jobs.ie, even the HSC, you know, HSC, I don't think people talk about like the HSC career page a lot. Check that page, sleep on that page, you will find a good amount of healthcare positions, support work positions, social care work positions as well. And let me tell you another thing, for me, when it comes to job applications, when it comes to even roles or areas like this, your best bet will be indeed.ie as opposed to LinkedIn and all these very fancy ones, okay. Indeed.ie has like a lot of them, and not just the ones in Dublin, they have a lot in other counties as well, okay. So do not restrict yourself to only healthcare assistant jobs in Dublin, okay. Look outside. But let's say, for example, if LinkedIn or maybe irishjobs.ie has about 10 vacancies, Indeed will have 500 vacancies. The ratio on Indeed is just, I don't know why a lot of companies or employers, you know, post on Indeed when it comes to these job applications, but that would be your best bets for job search. I won't even lie to you. Another one would be networking. So connect with professionals in the healthcare industry. You can do that now through LinkedIn. And then the other one would be like local healthcare facilities. So you're directly contacting, like, you know, hospitals, nursing homes, care homes, and, you know, inquiring about job opportunities. You're checking out these nursing homes or hospitals, they're checking out like the HR who is working there, or like the recruiter who is working for that company, and reaching out to them. Even sometimes when you don't see any job opportunities on their website, but you're reaching out and saying, you know what, this is who I am, this is my skills, my experience, you have any openings for me in this position, what can I do, this is what I can do, you know, just positioning yourself right, okay. And then application tips would be actually tailored CV. So you have to create a CV that highlights your relevant skills, your training, your certifications, and your volunteer experience. Like you have to tailor a particular, like I know we have different CV for different things, but if you can just, when you're applying for healthcare job, try and just tailor your CV to only the healthcare experience. It's going to put you in a much better place than when they are kind of saying like, or maybe customer service, and then they're not saying, oh, healthcare assistant. I'm not saying that you cannot do that, because sometimes there are some positions that you would work in that you would gain transferable skills for you to become a better healthcare assistant. But if you could just generally tailor your CV or whatever skills that you're putting in, they kind of have to align. You cannot say you were a construction worker and then you're coming to work in healthcare. Like, let whatever transferable skills or transferable role that you're coming from and going into kind of align. Do you understand what I'm trying to say? Yeah. And also have a very good and strong cover letter. So the next one will be preparing for interviews. This one is one that, you know, you've done everything. You're like, you know what, I'm ready to get the job. I'm ready to work as a healthcare assistant. My CV is right, my cover letter is right, and you're probably now called for an interview. So you have to prepare for that interview, okay? You have to be ready to answer questions about your understanding of your role as a healthcare assistant, your motivation, how you handle challenging questions, scenario-based questions. You have to practice some of them as well. What would you do in this position? If a clear resident is choking, what would you do? What's the meaning of this? If you want to see a video like that, I've done something like that before, but if you want to see like an updated version of the kind of interview questions you prepare for, please do let me know, leave down in the comment section, and I'll actually do that. So becoming a healthcare assistant, especially in Ireland, with no prior experience, is actually an achievable goal with the right approach. It's possible, you just have to do it right, okay? You have to have the right approach. You have everything that I've just said here. Try not to omit anyone. If you can fulfill all of these things well and position yourself right, trust me, you're definitely on the path to becoming a healthcare assistant with little or no experience. So yeah, I'm going to actually stop here. This video is sort of long, okay? So thank you so much guys for watching. If you have any questions, please don't forget to leave it down in the comment section down below. Please don't forget to subscribe there. Please subscribe to me, please. I'm begging you now, please, okay? And yeah, that's pretty much it. Thank you so much guys, and I'll see you guys in my next video. Ciao ciao. Bye guys.